I wanted to be able to provide for the community, being able to interact with children who are in the greatest of need. So when I came to New Jersey right after graduating from my residency program in the Bronx, New York, it was a nice fit. Being in Trenton just made me feel good.
When I went to medical school, it was it was way back in the 70s, and the thought was if a woman went to medical school, the only thing she was fit to be was a pediatrician. And I, of course, was very annoyed with that approach, and therefore I said I'll never be a pediatrician. So I tried everything else, and each rotation I went through, I found that I really wasn't happy until I hit pediatrics, where it just all made sense, and it was very easy to interact with the children.
I think pediatricians have a warm spot in the hearts of most folks, both patients and legislators and government people. And I think as a pediatrician, you have a chance to do something more than just take care of the individual patient, and you actually probably have the need to do something more, because care for kids is such a fragile thing.
Within the communities, we're working with pediatricians and their healthcare teams to be able to share their pediatric leadership and expertise within medical home neighborhoods. And we're working with families to help them understand why it's so important that their child has a pediatric medical home.
Medical home is basically a place that provides continuity, provides access to care, provides coordination of care. It was originally started in the late 60s, the concept by the American Academy of Pediatrics, really for providing care for children with special care needs. And now it's taken on a different role, where it's basically encompassing much more, and is seen as the center of pediatric care.
I think advocacy occurs on many different levels. I think on a daily basis, for me, it occurs in my daily patient interactions, whether it's making sure that my patient has all the vaccines they need, making sure their diet is good, making sure their development is adequate, and making sure they have access to all their healthcare needs. Well, advocacy is also on the community level, in terms of making sure that my patient has access to all their community resources they may need, again, to optimize their childhood. And finally, advocacy occurs on the legislative level, where we can work as pediatricians, work with our legislators, and making sure our children and their families have access to all their healthcare rights they're privileged to.
For me, the most gratifying part of being a pediatrician is watching children get better. So children come in sick, and you intervene, or they just get better despite you. But you see a child who came in ill and now walks out and is able to go back into the community and enjoy their childhood. The other thing that I personally find very invigorating and I really enjoy doing is teaching. We have a pediatric residency program here. We have medical students, and the ability to teach this next generation of pediatricians I find incredibly fulfilling.
I first got involved with NJAAP when we started doing projects under the PCOR and the EPIC programs that they started up. And I found it a really very in-depth learning experience. It's amazing what we don't know about things. And then you start interacting with people who do know about it.
I've only been a pediatrician for 10 years, but I still obviously learning on the job on a daily basis, whether it's just from my patients or from my more senior colleagues. And then the AAP provides me that network in terms of accessing to senior pediatricians, other community-based organizations, and what they're doing, and learning from them and how I can better my practice as well.
I would strongly encourage and urge every pediatrician to be a member of their National American Academy of Pediatrics, as well as their state chapter. Regardless of what state they're in, it makes a difference. It's about bringing health, behavioral health, mental health, oral health, education together, because that's what children are experiencing.
As hard as people make medicine out to be these days and how difficult it is, I still think pediatricians and pediatrics is just a wonderful place to be. I think every day I feel very good about having the opportunity to do what I do.